welcome as people are joining. I know that we can't see everybody, so we're just going to give a couple moments as participants join, and then in about a minute we will get started. While you're waiting, if you want to make sure that you know how to use chat and the Q&A feature, that will end up being really helpful later. So welcome. I think I'm starting to see the numbers sort of peak here. So I'm going to go ahead and get started and introduce the webinar. And then in a moment or two, in a couple of slides, we will introduce ourselves. So the title of our presentation today is called Talking Matters: Considerations for Testing when Evaluating Children with Selective Mutism. And I'm Dr. Rachel Busman, and this is Brooke Catanzaro, and we're very excited to be here. We want to just do a couple of housekeeping items. First, we want to thank that this webinar was possible due to a very generous grant that the Selective Mutism Association receives from the Gordon and Marilyn Macklin Foundation. So it's important for us to recognize them. They really do a lot of great support of our work. Also, if you are a treating professional, and we're going to ask people as they join, if you want to pop in, if you're a parent caregiver, or if you're a treating professional, you can just chat to us. So you should be able to use the chat. That would be great because we'll get a sense of who is on the call. Or if you're an educator. If you have, thank you for the first person who typed in here. So if you have registered for CEs, you can obtain those CEs after. You have to stay the whole time. So you're with us for the whole hour. If you are getting CEs, just make sure that you do the survey at the end and answer the questions. If you didn't do, if you did not sign up for or register for CEs and you want to, you still can. You can go to your CE Go dashboard and you should be able to navigate in there to pay for CEs. And if you have any questions, there's even a phone number there. So, someone from the UK, super excited. We're also recording this, and really glad that we have like a range of people in our call, including caregivers and professionals. So Brooke and I are going to really try to be able to really appeal to all. So let's just walk through what we're going to be doing. We are going to give some introductions in a minute. We'll just tell you a little bit about who we are and what we do. We want to talk about what do we mean by testing, because I think that this is something that can get a little confusing, and we want to get on the same page and have the same common language. We also want to talk a bit about why children may get referred for testing. And then I think some of the important things maybe of more relevance to this particular group might be what kind of considerations do we need to keep in mind when evaluating a student with selective mutism. And then we'll talk about some tips and strategies for a variety of professionals to use, but also if you are a caregiver, what are some of the things that you might be thinking about? You can pop in the chat at any time. I see this is a really diverse group. We have someone from Hungary. We have people from Greece. This is super exciting. We have parents. We have different types of interventionists. So maybe you want to give a suggestion or offer some support. You can absolutely pop anything you want in the chat. No problem. If you have a question, you also, I think it's helpful if you use the Q&A feature, because you'll be able to put the question there and then we'll be able to see them as they come in. We might want to answer it right in that moment. We might wait until later on to answer it. And we're really going to do our best to answer as many questions as we can. And at the end, we will share our email addresses and we'll pop them into the chat. So if you have a question and it didn't get answered, we're happy to have you reach out to the two of us. Okay. So we'll give some introductions and then we'll also talk about why we wanted to do this talk. So I am Rachel Busman. I'm a clinical psychologist. I'm here in the state of New York. I am at Cognitive and Behavioral Consultants, as is Brooke, and we are a practice that specializes in CBT and also DBT. We do neuropsych testing, and we really provide school consultation And I run the Selective Mutism program here and our intensive program Voices Rising. I'm also a member of the board of Selective Mutism Association and was the president at this point several years ago. So I'm really very involved in the organization and also in just the clinical world. And I'm going to turn it over to Brooke to introduce herself.
Thank you. Hi, everybody. I'm Brooke Catanzaro, and I am an associate neuropsychologist at CBC with Rachel. We work very closely together. We're going to talk about kind of why we work so closely together throughout this presentation, but we see a lot of overlap in both of our treatment together in SM and neuropsych testing, and we're going to talk kind of through all of that and what that means today.
I think the reason we wanted to do this, and I think I think about this topic a lot, is because a lot of times there are reasons that children get referred for, whether it's psychoeducational testing or we have a question and I will refer to Brooke, who is on our SM team and also is a neuropsychologist. And I think it's complicated because there's a lot of times families or educators feel that they struggle with how do we assess these kids and how do we come to really good conclusions and then come to really robust recommendations when we also have this piece of SM. Additionally, I think one of the reasons why Brooke and I wanted to do this is because we do think that there are some tips and strategies that schools can use, that parents can keep in mind when doing testing in the school, or when, let's say, school or parents are wondering, do I need a deeper dive into neuropsych testing? So this really comes up a lot. Brooke and I, as she we've shared a lot of cases together. So we're hoping that this can just clarify some definitions, shed some light on areas that we think are really important, and then answer your questions. All right. So let's start with just getting on the same page with some language, and let's talk about what we mean when we say testing.
All right, I'm going to jump in here. I want to preface all of this by saying, because I'm looking at the chat and seeing that people are coming from all over and a lot of different backgrounds, which is amazing. And I want to keep everybody's mind thinking about that. Rachel and I are based in New York. And I know Rachel also is licensed in Connecticut. Our rules and regulations sometimes are different in different states. So a lot of this will be applicable to everybody, and there are certain things that might be different where you're living, and it's always important to just check in with your school district or your local guidelines and regulations in terms of making sure what we're saying here is also present where you are. All right. Jumping in, it can be so confusing when we talk about what is testing. There are so many different types of evaluations out there. There's a lot of different names for them. Some of them mean the same thing, some of them don't. We're going to talk through all the different major types of evaluations and kind of some of the differences that we see and what you can get out of each evaluation. Perfect. All right. So types of evaluations. I know there's a lot going on in the slide. We're going to break it down as best as possible. And if you have any questions that are applicable to this slide at any time, put them in the Q&A, put them in the chat. And if they're relevant at the time, we can definitely talk through them now. So one of the most common heard of evaluations is a psychoeducational evaluation. So this typically consists of IQ testing or academic testing. So looking at things like reading, writing, and math. Some behavior scales, looking at maybe anxiety or attention, a classroom observation, and that's okay. And then some behavioral observations as well. Rachel's sifting me through. That's all right. We're being flexible.
I'm really sorry.
Oh, good. This is typically conducted by a school psychologist, like many of you are who are writing in the chat. A special educator can complete this testing, or a licensed psychologist as well. I want to stipulate here that psychoeducational evaluations, yes, they include cognitive testing and academic testing. However, if you are seeking an IEP through your school district, you are likely going to receive other pieces of that evaluation as well. So you would get psychoeducational evaluation, you might get speech and language testing, and you might get occupational therapy testing as well. That's not always the case. And sometimes when it's a student's first time being tested in a district, all three of those evaluations are provided. If you have any questions about whether your evaluation at your school is going to include those 3 things, it's always a great opportunity to ask your school psychologist, guidance counselor, specifically, is this going to be looking at speech and language? Is this looking at occupational therapy? Is this looking at cognitive performance? All right. Another type of evaluation out there is a neuropsych evaluation. So this is what I'm completing every single week, testing children, doing all the things that psychoeducational evaluations include. So all those things on that left side of the screen, plus a little bit extra, looking at things like language testing, visual and motor skills, some of those handwriting skills, our attention, our executive functioning systems, looking at short-term memory, long-term memory. Essentially, a neuropsych evaluation includes everything the psychoed does and just can take a little bit deeper dive, a little bit more comprehensive view into some of the other processes that go on for students in their brain. So a neuropsych evaluation is conducted by a neuropsychologist who is a licensed psychologist that gets specialized training and understanding of that brain behavior relationship. So it just takes a little bit deeper dive than the psychoeducation evaluation can include. The last part here on the screen is what we call an independent educational evaluation. This is essentially, it could be a neuropsych evaluation, it could be a speech and language evaluation. It's any private evaluation that you seek as a parent that your district, in your school district, is paying for. So a couple of stipulations when it comes to getting an independent educational evaluation is this has to be something that's considered by your school district. As a parent, you can't decide, I'm going to go get a private evaluation and my school district is going to pay for it. This has to be a conversation that's already had prior to the onset of testing, that you reach an agreement with your school district that they, one, might not be able to provide the resources or personnel to conduct the testing, or the school determines a private evaluation for more information is necessary. That would then lead them to decide that we might either pay for half of the evaluation, all of the evaluation, whatever agreement they come to. It has to be a consensus amongst both parent and school district.
Now you're ready. Okay.
Okay, awesome. So why do students, kids get evaluated? A whole lot of reasons is really the main answer. A significant portion of children with SM have comorbid conditions, aside from just anxiety-related disorders. Okay, the most common referral concerns are going to be on this screen. And if they're not, if you had things that have come up, common referral concerns, reasons that you have referred your child for testing that you don't see listed here, definitely type them in the chat. I'd be really curious to see some of the other common referral concerns that people are getting evaluations for. But what we most typically see, the number one reason is concerns related to selective mutism being, one, my child's not talking, so I'm having concerns of whether they are actually learning in the classroom. Sometimes this comes from a parent, and then sometimes it comes from a teacher, right? Who's just having a hard time understanding, where is this child at? Are they on grade level? Are they learning? That's the most common concern. Some of these things might look like trouble with acquiring academics, so reading, writing, and math. You can see there's an exhaustive list of some of those things here. So it's just like sight word decoding, learning our sounds and letters, spelling, reading comprehension, all of these things related to reading, writing, and math. As well as, you can go to the next slide for me, Rachel. Thank you. Difficulty concentrating in the classroom. So signs of inattention, distractibility, maybe some hyperactivity, difficulty comprehending and following directions, difficulty remembering information, completing multi-step activities, speech and language concerns, which could be articulation, understanding complex language, social language, interacting with peers, and then maybe just behavioral concerns acting out in the classroom. Another common concern is the possible consideration of, is this selective mutism? Is this autism? Or is this both? And we're going to kind of talk through teasing that one apart, because that one can get a little bit tricky sometimes.
And so I didn't necessarily see anything in the chat. I think Brooke has put together a pretty detailed list, but I'm curious, I think we're curious if as caregivers who are on this call and also treating professionals, if there are other reasons that you or educators might make a referral. So as we go to the next slide, you can absolutely pop that in there.
All right, I can continue for this. We put this in here because part of getting an IEP means that your child has to undergo testing. So in order for an IEP team or your school team to decide that your child is eligible to receive certain services, whether they're academic services, speech and language services, physical therapy, your child needs to be evaluated, right? Schools need to know, where is this child at in terms of age expectations, grade expectations, all of those things. So getting evaluated is just part of the IEP process also.
I know that we have an international group here, and so I really would, be curious. I'm going to make an assumption, but I don't want to totally assume that so just for anyone who might not be familiar, IEP is Individualized Education Plan. And I'm going to make the assumption that in different countries, maybe it's not called this, but there's probably a similar process. A parent or someone has identified that there's some level of concern about learning and that there's going to signal a process to start that involves some level of evaluation, a convening of a team, and a discussion of what that means and then what we do. Okay. So let's talk about some considerations around testing. Obviously, when we think about evaluation, whether that's happening in the school or whether that's happening privately with a neuropsychologist or whether that's through an independent evaluation that was, I'm just looking at the chat, but I'm going to stop. Whether that is something that's, decided by the district and the parents, there are definitely considerations that we want to take into account. So I'm going to parse it apart when it is specific to one type of assessment. But in general, this is really the big thing, right? So not to boil things down just to a picture, but really the biggest question comes up. Okay, we have a question about learning. We have a question or, what just came up, or we're looking to see if we need to add more testing, right? Or we need to determine if we need to add a particular intervention. Okay, great. For most kids that speak and need to perform in some way in a verbal fashion, we go into another room or we go into the person's office and off we go. And maybe with a tiny bit of warm up and, building rapport, we off to the races we go. And for kids with a diagnosis of selective mutism, this is sometimes not possible at all or not possible yet, especially when one of the presenting pieces has to do with the speaking itself. So if the child is not yet talking, naturally the question is, well, how am I going to do this assessment? Additionally, if the child is talking but a little bit, that still also is kind of the elephant in the room when testing requires, as Brooke knows, because she sometimes spends 10, 12 hours with a kid testing them, it requires actually quite a bit of engagement. And a lot, if not all of it, is verbal. There are some nonverbal measures, but a lot of it requires talking. So yes, that's the elephant in the room. So this slide isn't meant to be facetious in any way, right? So on some level, you might be thinking, Rachel, why are you asking this ridiculous question? No, testing can't wait, right? But really, very often, and I will have these conversations with Brooke, and on our SM team, often we'll bring up, I'll just use the name Jackson because that's my son's name, and that's who I usually default to as my kid that I talk about. I have some questions about Jackson's learning. I wonder if he's behind in reading. I wonder if he's having a concern with X, Y, or Z. And then Brooke will be like, well, where is that child in terms of talking? Like, we want to be able to get the best assessment of his abilities and areas of strength and areas of concern. And if he's really not yet talking, do we need to do this now or can we wait? And so oftentimes we will talk about it's sort of taking an active wait process. It's not like, let's talk in 8 months. It's let's talk when the child is, let's say, engaging in SM treatment, right? And we're able to hopefully connect people to SM providers or providers who are willing to learn SM skills. But if the child is able to be talking more to a bigger extent, then providing the time it takes to do that, to build up some speech, will really make the testing much more robust, right? And so the idea is, can we wait while we're putting some of these other things in place, or just bolstering, right? So the goal really is to increase some meaningful speech, or increase speech that we get some more meaningful results, right? If the testing can wait, I think what can sometimes happen, and again, this is where every state is different. And when Brooke said, every state and place is different, not only that, I've sometimes sat on IEP or 504 meetings in the same county, and every school is a little bit different. So if testing can wait, it does not mean we're not working on goals, right? So hopefully we're still working on brave talking goals. If the testing is for an IEP, and again, this talk isn't really very specific to the IEP or 504 process, and we have some resources at the end for those who might want to watch some videos or get more information on that. But oftentimes, if you are thinking, I want to pursue an IEP, go through the IEP process for my child, or a school team is thinking, we really need to do evaluation to determine eligibility for an IEP. Implementing a 504 while waiting, yes, they are separate processes. And at the same time, a child with a diagnosis of SM that is impacting them at school, they're going to qualify for a 504. And while that's waiting, implementing supports that can be put in place until the testing occurs. Now, here's an example of things I have absolutely seen in New York, and I've absolutely seen in Connecticut for sure. That, for example, the child might receive, and these are called things in different schools, but some type of building level support. So it might not be that the child is classified in special education or under special education and is getting speech and language or is getting counseling, but maybe under the 504, we're doing sessions with a school psychologist or a friendship group to build social connections, or consultation with a speech language pathologist, right? Or getting some reading, building level reading support to bolster reading. So it's not the idea, oh, we can't do it, so we're not going to address it. We actually very much want in the 504 process to talk about where are the areas of concern. I don't want to give everyone a headache by going back in slides, but let's say we have concerns about phonological awareness or writing or math, then let's address some of those things while we wait to have testing that's definitely going to be more meaningful. Okay, I'm turning this slide over to Brooke.
All right, so if testing cannot wait, right? First of all, there's a lot of reasons that testing might not be able to wait, unrelated to just not speaking, right? If we have behavior concerns that are leading to safety concerns at school and testing needs to be conducted, that's a different situation. And we need to talk about how can we best serve the student, even if they're not fully speaking yet, but to address some of those safety concerns. So that safety is always #1 priority when we're thinking about, can the testing wait or not wait? Some of the other reasons, so if testing cannot wait, there are a lot of questions that we want to ask ourselves and that we want to ask the providers that would be interacting with the student. One of these questions is the child likely to speak at all, and under which specific conditions? I think probably everybody on this webinar, especially parents, can understand that in different settings and in different conditions, their child will speak and will feel more comfortable. So understanding what are those specific conditions that the child is likely to speak in, if at all. Another question we want to ask is the evaluator familiar with selective mutism as a diagnosis and the interventions associated with selective mutism? And we're going to talk through, are these things necessary? Are they not necessary? These are just some things we want to make sure our mind is thinking about as we consider the testing process. Will a caregiver need to be present, and to what extent? So does a parent need to be present during testing? Does another teacher in the building that the student speaks to need to be present during testing? Does the SM provider need to be present during testing if you're seeking a private evaluation? All these different things we want to just make sure our mind is churning and thinking about. Would a fade-in session help build comfort and or increase the likelihood of a child speaking? And if the child cannot participate verbally in the testing, what conclusions will be made? How will these testing results be interpreted? And is the testing valid? So we're going to talk through all of these things and kind of tease apart each one, because those are a lot of questions to be thinking about. All right, we can move on to the next one. Perfect. All right, some key considerations. So evaluators, whether we're talking about a school psychologist acting within the school domain or a private evaluator, a neuropsychologist, a speech and language pathologist, any private evaluator must understand the specifics about the child that they are evaluating. What does this mean? So specifics about the child they're evaluating could be their level of verbal engagement. Some of the things we were talking about in the last slide. Are they speaking with parents at home? Do they speak with a sibling at home? What volume do they use when they speak, right? Are they speaking in an audible volume? Are they speaking in a whisper? Some of these things, we just want to understand the specifics about the child themselves. We also want to understand specifics in terms of developmental history, right? What things has this child encountered up until this point in their life that might be impacting not just their speech and the selective mutism, but other things as well. Another key consideration is if the child is unable to engage behaviorally, like they're not able to point during testing or write during the evaluation, or requires an extensive period of time to respond, will this impact the testing? Yes, absolutely. So we need to keep that in mind. There's a consideration that this will absolutely impact testing, and like to what extent it was kind of like a wait and see throughout the evaluation. And it just should be noted through when we're talking about how we conceptualize all the things that we're looking at. If the child is unable to engage verbally, right? They're just having a really hard time becoming verbal with the evaluator. They might only be able to complete nonverbal tasks. So this is a common question amongst a lot of parents that I see is, my school district completed testing and they only gave nonverbal measures because my kid's not speaking at school yet. Is this wrong? Did they do the wrong thing? Absolutely not. So nonverbal tasks is always an option. It just doesn't tell us the whole picture. So it can miss really important information about their verbal memory, their reading fluency. Think about how do we understand how a child reads out loud if they're not speaking out loud? So some of these things can just be missed. It's not a waste of time. It's still going to tell us important information, and we're going to talk through what that information means, but it's not a waste of time. It just doesn't tell us the whole picture. And lastly, even if the child becomes verbal with the evaluator, it might still be an underestimate of their abilities. So we just want to keep this in mind that no matter how comfortable they feel with their evaluator, even if they are the most trained evaluator in selective mutism, it still might be an underestimate of their abilities. Okay. I'm going to go through this one like a little bit quicker because I feel like some of these things are important, and like we're going to talk through like the tips and strategies that kind of address some of these behavior observations. But behavior observations can serve as a form of assessment. So when we're talking about assessment, it could be standardized assessment, and then there's non-standardized assessment. Behavior observations are just things that people notice, evaluators, parents, teachers. Important things that we want to consider are who the child currently communicates with and where. So we talked through already, like where the communication takes place, what environment it doesn't take place in, things like that. Also, we want to pay attention to what are the visible anxiety symptoms seen throughout testing, right? A lack of eye contact, maybe bouncing their leg up and down, speaking in a soft voice, and then some compensatory behaviors that students engage in for speaking. So maybe speaking in a whisper, nodding their head, pointing. All these things serve as important forms of assessment for us outside of just our standardized assessments.
I also would just add that one of the things that can sometimes happen is I think that all of us would agree that if a child is in an interaction and they're chewing on their hair, or they're biting their nails, or they're visibly looking, quote, anxious, we would perceive that as anxiety, right? I can't see everyone's faces, but I imagine everybody nodding and going, yes. However, let's say you have a child who's in your office or in a situation and they're being prompted to do something and they hide under the desk. almost in a, I guess hiding could be anxious for sure, but that they might look more disruptive, right? They might push the items of that they're being asked to do off the desk. They might fling a pen, right? They might be more quote defiant. And I say quote defiant because I did see a comment in the chat where there's some questions about defiance and oppositionality, and we absolutely see kids who are both anxious and defiant. And it's really important to note that some kids who are anxious and are engaging in avoidance behaviors may look very defiant. And so that's important as a behavioral observation. And we want to, I have seen some reports sometimes, there's some characteristics of kids that can sort of be sort of pejorative in nature when it's characterizing things as flat out refusal. And sometimes refusal comes because there's a manifestation of anxiety, right? So just important to keep in mind. Okay, so let's talk about some tips and strategies because I think that is hopefully why a lot of people are here. Okay, so one is to consider a private evaluation, right? So whether it's a private evaluation that you are seeking, let's say with a school, and you're seeking an independent evaluation, right? One of those IEEs, or you as a caregiver are saying, I would like to consider neuropsychological evaluation because I really want to have like a deeper dive, right? I'm going to use my metaphor, and Brooke can tell me if it's a good one or not. I sort of sometimes think of like psychoeducational evaluations as I'm going to remodel my kitchen and I'm going to redo my cabinets and I'm going to take the face of the cabinets off and I'm going to redo them. Very valid way of doing that. You're going to change that. It's perfectly fine. And I think of a neuropsych as like gutting the whole kitchen, right? And it's there, one is not better or worse, but neuropsych evaluations are naturally typically, Brooke, 9 hours of testing, would you say?
Yeah,
About,
depending on the student's age, 8 to 10,
right.
sometimes
And
12.
so it's a very deep dive. And so while a psychoeducational might pick up on some more like surface level discrepancies, right? For sure, when there are glaring learning disabilities or glaring discrepancies. And it's not diagnostic, right? So a psychoed does not diagnose ADHD or autism, and it's just not a deeper dive. So there isn't going to be the ability to look at all these data points in such a detailed fashion and look for what I think are sometimes much more subtle areas of deficit. So that's one, right? So maybe there are some really complex questions that we really need the answer to that really a psychoeducational just couldn't possibly have the time and capacity to do. Maybe we need an evaluation because maybe we need a private evaluation because we really want an evaluator who's very familiar with selective mutism or willing to learn. So what I will say is while Brooke and other neuropsychologists I've worked with in my prior life when I was at Childmind, I had trained them a bit, or Brooke very much so because she does a lot of SM work, like in SM skills. It doesn't mean you have to have an expert. Let's just be honest. There's not always an independent evaluator or neuropsychologist who's an expert in selective mutism. I think the piece is, does someone have experience as an evaluator with anxiety? If they do, are they willing to learn and understand a little bit about what is going to make their evaluation more valid, hopefully, with a child that's better able to connect and speak? To the second point, with an evaluator who can consult with outside providers, right? That's really important. And sometimes to a level that's very different. I'm sure Brooke can tell me if she's treating, if she's testing a kid and selective mutism isn't on the table and they have an outside therapist, I'm sure she reaches out to them and chats with them, but she's likely not asking them, how am I going to engage this person in the testing process? Because alone, her many years of testing experience and training have trained her to do that. The time for fade-ins is really important, right? So this speaks to some of the things that are difficult to do in a school sometimes, right? And we'll talk about this a little bit. Sometimes fade-ins are really necessary, right? And when we mean a fade-in, we mean and I'm going to talk in more detail, but the transfer of speech from someone the child talks to a new person. And I don't mean the administration of testing. I mean time alone to establish speech. We need someone who's going to be able to be flexible somewhat with testing administration, and we'll talk about what that means. And oftentimes when certain diagnoses are on the table, right? So especially when autism, for example, is a question. And I learned this a little bit in more detail earlier today, you can classify a student under an IEP under autism, right? And a school might choose or select that classification. It might be absolutely correct. Maybe that child has a lot of features of autism. The parent has endorsed features of autism, and the child would benefit, let's say, from an 811 classroom or certain supports that are in an autism support classroom. And that isn't actually a diagnosis of autism. So on a rating scale alone, or a 2 rating scales, isn't sufficient to provide a diagnosis of autism. So sometimes we have some complex diagnostic questions, and having a private evaluation would really be very helpful in that situation. Setting the stage goes a really long way. This is across the board, regardless of the evaluation you're having. So let's say it's at school, or same thing as if you are having it outside of school. Time must be taken prior to the onset of the evaluation to engage the child in ways that will decrease anxiety and build rapport. So spending time to really understand the child's likes and dislikes, favorites, activities they like, prizes they like. And unlike a time when, if you're in a school and you're a school psychologist and you can just ask Brooke, go over my treasure box and tell me what you really like. A child with SM is likely not going to be able to say that, or they're not going to say, I want you to use a purple marker for my bravery sheet, or I really like purple, so let's do, purple stickers, right? So you're going to need to communicate with the parent, likely, or maybe the teacher, to get these piece of information. Incentives and reinforcers, really important, right? So when I work with Brooke, I let her know the things that the kid I work with likes. I might give her some prizes, and we want to be pretty generous and front load reinforcement. So Brooke is not doing like 3 hours of testing and then you get a small prize. She's really building it into a lot of sort of front loading reinforcement. Of course, we don't give reinforcement for correct answers or volume of output, but it's really for just really the level of engagement that wherever the child is. So if you're in a school and the child that day is going to complete 10 minutes of some portion of the testing, they're really earning that for coming into the room and sitting with a new person and maybe playing a game with a new person. So we want to be really frequent. We want to be intentional and pretty generous. Okay, so fade-ins. It is beyond the scope of this talk to be able to go through the entire fade-in process. I love talking about it, however, but I can't. What I will say is a fade-in is needed if the child is not speaking at all to the new conversational partner. What the heck is a new conversational partner? Well, let's pretend that Brooke is a school psychologist that's fairly unfamiliar to the child, or familiar, but not really super well known. And if Brooke can meet with that child and the child can speak with her without anybody else doing anything, then likely a fade-in is not needed. Now, we might have to make different conclusions based on how much verbal output Brooke gets. But if Brooke is able to establish a speaking relationship, even a little bit, with a child, then we don't need a fade-in. But a fade-in would be needed if Brooke meets with the child. And it's not that she walks into the classroom and says, like, what's your name? What do you like to do? Like, I don't think anybody would likely do that. But after a little bit, she's not able to get any verbal responses. Then we need to pass the talking baton. And how we do that is you go from someone that the child already talks to, likely the parent. So I often will say the caregiver. It could be the teacher. So that could be a great opportunity that it's the teacher that the child already talks to, or maybe it is the school psychologist the child already talks to, but they need to meet with a special education teacher for some reason. So we need to transfer speech. And the way we do it is a process, right? So when I talk about a fade-in, what it really means is first starting with the person the child already talks to and slowly moving that new conversational partner closer, and they need to be doing something, and that's using some level of SM skills. If you're interested more about fade-ins, for sure, check out our library, and you can totally reach out to me if you have specific questions. But it doesn't just involve time in and of itself, right? It involves first the child talking to the person they already talked to, and then that new person showing interest and enthusiasm, and then starting to engage in first maybe nonverbal activity, like, oh, go ahead and hand me a marker. Oh, thanks for sharing with me. Oh, now we can play tic-tac-toe together. It also should start with a fun activity. So I would never do a fade in with Brooke and have her go, like, the fade in activity we're doing is a part of testing, but also I wouldn't have us do something adjacent to testing. I'd have us just do something fun. Advocating for flexibility, I also think is important because testing is likely going to take more time than usual. It's important, and Brooke, of course, could speak more to this if we want to, that we want to preserve that testing has a standard administration, right? That's why Brooke has all the experience and why she's done a longer fellowship than other people, right? She's specializing in neuropsychological evaluation. You don't just wing it when you give an IQ test. You have to follow certain rules about how you ask the questions, right? The type of things you say after a child answers, so that we call it a standardization for a reason. However, when there's enough time, after a subtest, let's say, is administered, right? And I'll give an example, and Brooke, you can tell me, be quiet if I'm doing too much. But let's say you've asked a kid a bunch of questions to tell you definitions or something, and they just like don't answer. And so naturally, they're not acquiring any points for that administration. Oftentimes what will happen is you move on to the next test. A testing of limits would be an example of, like, I wonder if I ask this child in a different way, if they'd be able to answer. Like, maybe you use multiple choice questions. Maybe you ask them to write it down. Now, is that standard? No, but it would give you a whole lot of information if all of a sudden you asked a child a bunch of math problems or words and they wrote down accurate information every single time. Yes, Brooke?
Yes, I'm going to add that it's also important, like, as the administrator, to understand that, like, when you're doing that, if the student's providing you a correct response, you're not attributing points for that correct response.
Correct.
It's just giving you important information that you can add into your report of, okay, yes, this student got a raw score of 0, right? They didn't get any points according to standardization. However, when asked in a forced choice format, in a multiple choice format, they were able to correctly respond.
Such a good point. Yes. Also, how to manage I don't know responses. So those of us that work with kids with SM often struggle also with sort of whether this is a separate diagnosis or just part of the SM. That's another conversation, but I don't know, right? And again, you're giving a standard evaluation. Brooke can't just say, Rachel, I know you really know, just tell me, right? Also, kids with SM and anxiety will often just say, I don't know. It often is a learned way of getting sort of moving the person on. Sometimes the child's mulling between a couple of answers and they're not sure and they feel anxious about the performance. So being able to, again, be flexible and maybe giving multiple choice later or testing those limits later can be helpful. We've often had parents send video sample. We cannot send test items home with parents. That completely breaks standardization. But you can ask a teacher to give, let's say, some reading material or any number of tasks that could be done via video. And then having extended conversations with treatment providers and teachers, just really to get some qualitative information. One of the things that's challenging is when you're working in a school, as I'm sure some of the folks on the call can attest to, when you have a caseload of a lot of students, you don't always have the multiple hours and options of being able to do all of these flexible parameters of testing. I'm going to move us along just because of time. Okay. And then I'm going to go back to Brooke.
All right, so let's say you just complete an evaluation, whether it's through your school, through a private evaluator, a neuropsych, what happens next? So this could probably be a separate talk in and of itself, but here are some just highlights of what can happen next after the evaluation. Feedback should always be given to the parents and to the school district as well. So feedback should be clear to the caregiver in terms of what the results are, what do they mean, and any diagnoses if you're seeking a private evaluation. The interpretation of the results should always take into account how much the child is speaking, their level of engagement, the volume at which they're speaking at, the the ability to understand the child when they're speaking. It should take into account all of these different things. The interpretation of the results should also take into account the context of testing. So yes, the child might speak in a one-to-one setting, right? Speak in a one-to-one, really close setting with like an evaluator where they're getting tons of praise, tons of reinforcement, they're getting incentives, and they're still not talking in the classroom, right? We have to understand that these are two very different settings, right? The classroom is a really loud, anxiety-provoking place for a lot of students, not just students with SM. So we have to tease apart that just because the child speaks in this one-to-one setting doesn't mean it's going to generalize to the classroom without putting in some sort of interventions and supports. After an evaluation, a team meeting is normally what takes place in a school district. This could be your child's study team. It might be your IEP team. Sometimes if evaluations are done through a hospital, the hospital has a team that's conducting the evaluation. And that team meets to determine the recommendations that are going to be made, certain supports and accommodations that can be put in place for students. And a couple of last points here are the accommodations, the supports, the interventions that are put in place might need to be tailored, right? So just because we ask for a million things from a school district, or just because a parent says like my kid needs X, Y, and Z, doesn't mean a school district can always accommodate those things. It's not because they don't want to, they might just not have the time and resources. So we always want to make sure we're asking the question, if you can't give me this, if you can't provide this kind of accommodation or service, what can you give me? What can we do to support Sally a little bit extra in the classroom? And we can always revisit testing or need for retesting after a period of time. So students should always be reevaluated in a period of time, but that can vary based off of where you're located, the school district you're working with, and the age of the student at the first time of testing.
I also want to add another thing when I think of how something needs to be tailored. So it may be that a student, let's say the student completed testing and let's say there's a school meeting, regardless of if it was private or not. And one of the recommendations is a common recommendation might be counseling in a group or meeting with a school psychologist in a group. Sometimes or oftentimes that might not be feasible yet, because let's say the child does not have a speaking relationship yet with the school counselor. So let's say a school psychologist did the testing and it's going to be a school social worker who's doing a friendship group or a social group. The way it might need to be tailored might be that the child receives counseling in individual or a group, and then it's specified that it's individual with the intention of then moving toward a group when the child is able verbally, right? And it might require fade-ins with one peer at a time or a smaller group at a time. So that's a way that might be tailored, right? So we might need to be very specific about it. Okay. So putting things together, we initiate testing because of some level of concern and a referral concern or concerns. There's a variety of testing that can be done. If you're doing it in the school, it could be often done in district, right? Or an independent evaluation, or you as a parent doing it completely privately. Also, I want to say that when we talked way in the beginning about testing that happens in a school for an IEP, I would say if you're getting a psychoeducational, meaning the IQ and academic, and you're doing speech and language and an occupational therapy component, that's going to be done by at least 3 different people, which means that you need to think about the fade-ins that may need to happen with the multiple people. A neuropsychologist like Brooke can do all that testing. She's not an OT evaluator, but can do some motor, visual motor testing and speech language testing. We've already talked about the specificity with which neuropsych testing can address concerns. We want to consider waiting if we can while we're working on helping the child be more verbal, while also putting some supports in place that would be appropriate to address some of these initial concerns. We need to take into account how verbal, if at all, is the child, right? Because really the truth is that every child looks a little bit different. So a child might be going to testing and they're able to talk and they're whispering the whole time. That's a very different type of evaluation than a child who isn't able to speak at all in the testing. We already talked a little bit about fade-ins. And then obviously we want the recommendations to really pull from sources of data and information, and also conversations with others, might look at video recordings of the child, et cetera. So these are I actually am going to share the next slide because I'm going to put our emails in the chat. These are just some reminders that the Selective Mutism Association conference this year we're really excited, is in Kristen, who's not visible on the call right this minute, but is behind the scenes as she's on our board, and she is our membership and special projects person, and is in Chicago. And we're going to be in Chicago for our conference this year, which is really exciting. First time since COVID. And there's a virtual option, which is we'll have recorded some recordings of our talks, not all of them, but some of them. Here's the link for that. And we're going to put that in the chat. I bet Kristen did it already. And then these are some resources. We're also going to make these slides available to people in a PDF, but I'll just leave this up while so that, oh, wait, she already did it. And she already put our emails. You guys are so good. So the YouTube channel, YouTube is good for things other than what my son does, which is just watch people play video games, which I don't understand. SMA has a YouTube channel, and there are a lot of really great videos on there of addressing a variety of content. We have an educator's toolkit that is, that's something you do pay for, but it provides you, Kristen, I don't remember how many hours, but I want to say like 16 hours, something like that, of video content across like elementary, middle, and upper school. And then Brooke put in here how to find a neuropsychologist. I will say, as I'm opening it up to questions, and I guess I'm going to unshare so you can see us. One of the questions that I think comes up a lot, and Brooke, I'm going to let you answer this, is sometimes we'll hear from a parent who will say, I did a private evaluation, but my school district is saying that they need to test my child. Is that allowed, or is that right? Could you answer that question?
I can. And I think, again, this might be one of those things that, depending on where you're located, it might be a little bit different, but in most situations, from what I'm familiar with, if you seek a private evaluation, it is very common that your school district does want to do their own testing at the school district level. This is completely normal. You should absolutely let your school district do that testing. And just know, yes, there might be differences between the testing. That doesn't mean someone did something bad or good. Again, we have to keep in mind all the considerations we talked about with how testing can vary with different evaluators, their level of training, their level of experience, the time that they have, all of those things. So yes, your school district might want to do their own level of testing. That's really common.
And we're going to put our emails in there again. It's just up a little bit, but we'll put them again.
Yeah.
Similarly, if a school does testing and the parent says, I feel like this missed something, the parent conversely can also say, I'm going to do my own, I'm going to seek another evaluation. So I think the bigger piece is that, obviously, if you've administered some tests, Brooke, right? Some tests could be done as many times as we want. You could just administer it many, many times because it's different every time, right? Some things are more randomized, and some tests have practice effects where you can't just administer the exact same test, a week later. However, testing evaluators have lots of different forms of tests, right? So you would be allowed, or you can be able to do an alternative form of a measure. So it's pretty normal for a school to say we need to do our own process of evaluation. And it's also okay if a school does an evaluation for a family or a parent to say, actually, I would like to seek an independent evaluation. Hopefully everyone can see our emails in the chat now. They've been populated a lot. We have a couple more minutes for questions, and I don't see any open questions in the Q&A, but if anyone wants to pop a question into the chat, you're more than able to. I loved some of the comments that came through. Some of them were really, really helpful. There will be a recording of this, so maybe you watched this and thought, wow, it would have been great if so-and-so saw this. Someone said it would be great if this could be made available to a hospital or things like that. So I do think that can be helpful. Something else that sometimes gets asked for, and it just came up in my mind because I don't see a specific question, that is something that might be part of an evaluation at a school, might be something called a functional behavioral assessment, right? Or an FBA, which is like something that often is done by someone who has some specialized training in understanding behavior. And it's like, it's not just a classroom observation. So a classroom observation is coming into the class, and usually they're pretty detailed, but maybe it's a 15 or 30-minute observation. Like Brooke sat down at the table, she got up and got some water, she was fidgeting with her shoe, then she worked for 5 minutes. An FBA is going to be more of looking at antecedents, things that happen before certain target behaviors happen, what behaviors happen, and then what happens after. So I have seen this for sure used when there are some concerns about, let's say, co-occurring disruptive behavior, and also wanting to know how a teacher or an aide or other peers in the classroom are responding. So it gets it gives us like a deeper dive into some specific behaviors, the things that precede it and the things that come after. Brooke, would you say anything else about an FBA, or does that sound
Oh, I think that was great.
reasonable?
Very important point.
Because but that is not something that I would say is standard all the time. Right.
Yep.
But I think it would be very reasonable if a parent was seeking, is going through the IEP process and a psychoeducational eval is happening. And so we know it's going to be IQ, it's going to be some rating scales, it's going to be academics. I think it would be a very reasonable question for a parent to say, and the speech language evaluation, is that going to happen? That seems to me to be very, very reasonable to happen. Whereas an FBA isn't just standardly done. Yes.
Yes, and I'm thinking like this talk was not geared towards, again, the IEP process and the 504 process. However, an important point that I feel like I could have spoken about when we talk about psychoeducational evaluations is, if you are a parent who has concerns about your child, how do you bring them to the attention of your school district, right? Because in a setting where if your student or your child is not speaking at school, they might not be able to see all the things and the concerns that you're seeing at home, right? Whether it's attention concerns, behavior concerns, they might just not be seeing those things in their classroom. How can you bring these concerns to your school district in order to initiate either testing or some sort of more formal process happening? So this, again, is going to depend on where you live, but most commonly, if you have either your school psychologist, a guidance counselor, even the principal of your school district, the special education department of your school district, you can contact via phone, but mostly in writing. If you write a letter, a really short email or letter requesting, there's some things going on with my child that I really would love to get a deeper understanding about what's going on. I'd like to pursue some school-based testing. Your school district has an obligation to respond to you with some sort of response of whether they're going to do testing or initiate a meeting with a team to talk about whether this child qualifies for exploring the process or not. But as a parent, you can get the ball rolling in terms of giving your school district a little like nudge into looking at what's going on with your child.
And I would say it doesn't have to be a novel, but I would agree that it needs to be in writing, and it can't come from a therapist, and it can't come from a teacher. So it could be as simple as, I'm reaching out about my child, Rachel Busman. I have concerns about X and Y. I would like to start the process to determine eligibility for an IEP or determine eligibility for a 504. That actually starts a clock, and there is an obligation to respond. I'm really glad you brought that up. Again, I am very excited that we had such a diverse group of people all over, obviously the US, but also abroad, which I hope that was relevant for those, abroad. Again, we have less experience with that, and make the assumption that also there's a process there, right? There's a process of some level of evaluation, and then it comes to a meeting, and then we make some determinations. So just a few reminders before we jump off the call, which would be, if you're getting CEs, please make sure that you complete the post presentation survey and the questions that accompany it. If you got on the call and you were like, oops, I want CEs, I need those, go to your CEGO dashboard. There should be a dashboard. There should be a place for you to just pay for the CEs, and then you should be able to get that. And if you don't see that, you should be able to, Kristen has told me there's a number that you can reach and you can receive some tech support on that. And I usually, Kristen is excellent about posting these. I would think the video would be up in a couple of days, and that will land in the YouTube, the SMA's YouTube channel landing page, and you'll probably even see it by the most recent editions. So we really appreciate you being here, and thank you so much for attending. Have a good rest of the day. Bye.